Drugs that can be prescribed in pregnancy, these are the safer alternatives. So basically, you must understand here that nothing is marked as safe based on the history of usage by pregnant women in the past, and also any other data that is available. So these drugs are marked as safer alternatives. We would suggest that you keep this list handy with you. Every often revise this video and keep prescribing this to all women, not just if you're pregnant. These should be the alternatives that you use more often. Okay, so let's get started. Antiemetics in pregnancy, that is, if a woman has morning sickness or any other cause of emesis, then you will give um, promethazine, doxylamine, dicyclomine, prochlorperazine, metoclopramide. Okay, which one do they give in your hospital? So please keep that in your mind. So next, let's move on. Drugs for peptic ulcer, GERD, that is gastroesophageal reflux disease, that is acid problem, acidity. So you can give pantoprazole, omeprazole, okay, etc. I think some people were prescribing Rantac, that is ranitidine also. Famotidine also is there in the list. Move on. Laxatives to treat constipation. So note here that uh, intaking more water with dietary fiber, esophagular husk, lactulose works. So that is something that you can prescribe. Are you with us? What are we talking about? Constipation, treating in pregnancy, the safer alternatives. Okay. So keep this list handy and keep revising, keep prescribing these drugs more often to people. Okay. Antidiarrheals in pregnancy, oral rehydration salts, that is ORS. Okay. So to put her electrolyte in balance. Right. Okay, so yeah, so we got the charger on. Now, antidiarrheals we are done. Okay, good. So now let's move on. Analgesics in pregnancy. Very often you will need this to treat headache, body ache, joint pain, visceral pain. Some pain not that severe. So paracetamol, very easily you can prescribe this. Then you have ibuprofen low dose they are suggesting. So paracetamol is considered as a safer alternative. Okay. Now coming to anti-allergy medications in pregnancy, you can give chlorpheniramine. Very commonly, I prescribe this chlorpheniramine. It is in combination with paracetamol that we use it in some cold and cough treatment, right? Antihistamine it is. So please use anti-allergy medication, chlorpheniramine. Promethazine. I think we already saw promethazine in antiemetic also, right? Let's just go back here. Promethazine is there in antiemetic also. Yeah. So where were we? Here. Anti-allergy is done. Okay, guys. So we are moving on now. Antibacterials, that is systemic infection if they have in pregnancy, you can give. I have seen people usually give amoxicillin clavulanate. You can give ampicillin, penicillin G, cloxacillin, piperacillin, cephalosporins, erythromycin. Please remember that all of these should be given after test dose, right? Or more, just check how exactly it's being used. So you may have to give a test dose. Antitubercular drugs, so the HRZE, okay, that is isoniazid, rifampicin, ethambutol, pyrazinamide. What is not considered safe is streptomycin, but however, streptomycin is not in the regular regimen anyways, right? Antiamoebics in pregnancy, dilozanide furoate, paramomycin. Okay, this is antiamoebics in pregnancy. Guys, these are the safer alternatives. Okay, metronidazole is not the safer alternative. Please understand that. Okay, helminthic drugs in pregnancy. Yeah. So if you want to destroy all the worms, give piperazine, niclosamine, praziquantel. Piperazine, niclosamine, praziquantel. Not albendazole, mebendazole, etc. Best avoided in first trimester. So what will you give? Piperazine, niclosamine, praziquantel. Topical antifungals, people, now to treat superficial and deep mycosis in pregnancy. Clotrimazole, nystatin, tolnaftate. Clotrimazole, nystatin, tolnaftate. Say it. Clotrimazole, nystatin, tolnaftate. Very good. Next, antiretrovirals in pregnancy like HIV, etc. treatment. Zidovudine, lamivudine, tenofovir, nevirapine, nelfinavir, saquinavir, efavirenz. zidovudine, lamivudine, yeah, then tenofovir, nevirapine, nelfinavir, saquinavir, efavirenz. Okay, very good. Antihypertensives in pregnancy, methyl dopa, hydralazine, atenolol, metoprolol, pindolol, nifedipine, prazosin, clonidine. There's no labetalol in this list. Labetalol is mostly used IV in preeclampsia, eclampsia, I'm thinking, right? Because oral alternatives are there are better alternatives. That's what, right? For treating hypertension. Say this list, people. Methyl dopa, hydralazine, atenolol, metoprolol, pindolol, nifedipine, prazosin, clonidine. Very good. Let's move on. Take a break. Is it becoming too much? Take a deep breath and move to the next list. Anti-anemic, this you know. Very easily you will tell. Oral iron, iron dextran if required, folic acid, vitamin B12. These are safer alternatives. You understood, right? See, vitamins are usually considered safe. I think thiamine also is category A drug. So when we are here, let's talk about that. See, basically, there are categories of drug. We have A, B, C, D, X, right? C, D, X, something like this. So whatever is A is like a safer alternative, right? Some of B also. And then X is something that is bad, unsafe in pregnancy looks like, right? So you understood. So that's category of teratogenicity, right? Teratogens. So you understood the whole concept of this video. Okay. So now let's move on to the next slide. Anti-diabetics in pregnancy. Metformin orally they use, and insulin, human source is considered best means what? Best is insulin human, okay, but it is injectable, so they are talking about metformin. Okay, now let's move on. Smile, come on. Yeah, thyroid hormone in pregnancy that you can give to treat hypothyroidism. Thyroxine, very good. Thyroxine, I think they also call it as levothyroxine maybe. So if thyroid hormone is thyroxine, what is antithyroid hormone if you want to treat hyperthyroidism? Propylthiouracil is also considered as a safer alternative in pregnancy to treat hyperthyroidism. Okay, move on. Antidepressants that you can prescribe in pregnancy: amitriptyline, imipramine, fluoxetine. Amitriptyline, imipramine, fluoxetine. Say amitriptyline, imipramine, fluoxetine. Very good. If they have depression, give them all that. Anticoagulants, that is to thromboembolism. For thromboembolism, what will you give? Yeah. Heparin, unfractionated heparin, low molecular weight. Okay. But there are some other category A drugs that I saw weight. See, I think all these they are saying are category B drugs. Okay. Category B is still not category A. Remember that. But why didn't they write heparin here? Well, we go with the textbooks, so we read the textbook only. Move on. Anti-asthma drugs. Asthma if you want to treat. Inhaled salbutamol, salmeterol, ipratropium bromide, beclomethasone, budesonide, sodium chromoglycate. Remember, inhaled only they are talking about. So can you tell me the treatment of asthma in pregnancy? What drugs will you give? So we can give inhaled salbutamol, salmeterol, ipratropium bromide, beclomethasone, budesonide, and sodium chromoglycate. Very good, very smart child. Okay, move on. So this is the last slide we have. Okay, great. So people, so you looked at the safer alternatives of in pregnancy, and this is from the textbook, like we told you. Now let us go and understand one thing at this point, that we told you whatever are the safer alternatives in pregnancy, and it does not mean that it is safe in breastfeeding. In lactation, is it safe? That we did not say. We are not talking about that. That again you'll have to check, right? Next, one more thing I want to show you. What are the category A drugs that is like safe, considered safe, right? That is only these many. Category A means adequate, well-controlled studies in pregnant women have not shown any increased risk of fetal abnormalities to fetus in any trimester of pregnancy. This is the definition of category A. Human studies show no risk in any trimester. Adequate, well-controlled studies in pregnant women have not shown an increased risk to fetal abnormalities to fetus in any trimester of pregnancy. And what are the drugs in that list? Thiamine, vitamin B1, isn't it? Pyridoxine, vitamin B6, folic acid. Yeah, folic acid is vitamin B9 actually. So thiamine, vitamin B1, pyridoxine, vitamin B6, B9, that is folic acid. Docusate, senna, bisacodyl. These are for constipation, isn't it? For cough, you can give dextromethorphan, but I also told you that you can give what? Chlorpheniramine. Doxylamine is what? Doxylamine. It came under antiemetic. This is category A drug, remember, it is safe. Then coming here, levothyroxine, we already told you, thyroid hormone, isoniazid for treatment of tuberculosis, etc. So category A drugs are only so many. That much you got, right? Tell what are the category A drugs. They'll ask you in the exam means what you'll write. Thiamine, pyridoxine, folic acid, docusate, senna, bisacodyl, dextromethorphan, doxylamine, levothyroxine, and isoniazid. I have added this docusate, senna, bisacodyl to our list, though the textbook did not list it. We have listed it here because it is given as category A. Okay. So I think we are done in this video. Drugs in pregnancy, safer alternatives. One more thing I wanted to tell you people. Doxycycline is not safe. Please note this. I told you doxylamine you should give, right, for antiemetic, but doxycycline is actually red. That is, doxycycline you should not give. Wait, I'll show you. Doxycycline comes under category D. It has positive evidence of risk, so you should not use. So the whole point of this video is to look at drugs safe in pregnancy. So what we told you is always keep this list handy and prescribe these more. Guys, while you are on this video, there's a very important information. This ABCDX is not there now. Now it is replaced with many other categories like pregnancy, lactation, and females and males of reproductive potential. If they are in reproductive age, then what? Some different classification is there as of now. So I would like you to please remember this category, whatever we discussed is old categorization. Okay, bye bye.